Bill 31, the Health Information Protection Act, received first reading and has gone through extensive hearings through the committee process. Bill 31 would, for the first time ever in Ontario, provide broad legislative protections for the privacy, confidentiality, and security of personal health information. And it helps ensure that the information is used judiciously to improve health care and facilitate system change. Bill 8, the Commitment to the Future of Medicare, preserves in law the right of all Ontarians to access health care services based on need, not on ability to pay. It introduces tough prohibitions against two-tier medicine, requires mandatory reporting of practices like queue jumping and extra billing, and offers whistleblower protection so that these activities can be stopped. Furthermore, Bill 8 will help to usher in a new era of accountability in healthcare. As we move forward with improving our healthcare system, the Commitment to the Future of Medicare Act represents an important signal to Ontarians that the significant changes to come rest on a strong foundation of familiar values. While others might suggest that the only way forward is to abandon these principles and to throw up our hands in surrender, we will prove that health reform can and must be consistent with these values. The Romano report has set out in clear and compelling terms what our healthcare system needs. It's time to take the necessary steps to get us there. So what will a revitalized healthcare system look like? Well, frankly, it's going to look a lot more like a system. Services will be better integrated amongst the various providers that deliver them and will be modeled with the consumer's interest in mind first and foremost. I often say that when I look at the healthcare system, I don't really see a system at all. It's fair to say that many Ontarians don't experience a healthcare system either. Our vision is to build a true system, one that's integrated and driven by one common cause, to deliver the highest quality outcomes for our people. Our vision is of a system where all providers speak to one another in the same language, where there are no longer impenetrable and artificial walls between stakeholders and services, a system driven by the needs of patients, not providers. Accountability is the watchword of our renewed healthcare system. Let me be clear. By accountability, our government means that we share a responsibility with providers to deliver quality outcomes to our most important stakeholder, the 12 million people of Ontario. They're counting on us. They're counting on us to deliver results, so we must set priorities, because we believe that if you have 100 priorities, you really have none. Our government has 3 key priorities that we will be measured against. Number 1, reducing wait times for important procedures. For example, cardiac care, cancer care, and hip and knee replacements. Number 2, by improving access to family physicians and other members of the primary health care team. And number 3, making Ontarians healthier, a priority that will be measured by the rates of physical activity, smoking, and obesity. To achieve these priorities, some very fundamental changes will be necessary. There are 4 change strategies that we will initiate over the next year that I'd like to highlight to you today. Number 1, placing hospitals on a sustainable financial footing. Number 2, creating a culture of accountability and improved outcomes. Number 3, creating strong community healthcare services. And number 4, a new emphasis on healthy living, prevention, and health promotion. In each of these areas, fundamental change is necessary. I see these reforms as complementary, and I see these reforms as absolutely crucial. Let me start by talking about hospital funding, with change in our hospitals. Over the last few years, hospital funding has been growing at an alarming rate in the range of 10% per year. And while part of this can be explained by a growing and aging population, these kinds of increases are simply not sustainable over the long term. Furthermore, because hospital funding is the single greatest line item in the provincial budget, our inability to rein this in poses a threat to our healthcare objectives. I don't know if there's a simpler way or a nicer way to say this, but it just cannot go on. It simply is not sustainable. I'm not saying that hospital budgets cannot grow. They can and they will, but they cannot grow the way they've grown in the past. Let me be absolutely clear. Let me be absolutely clear. The days of double-digit increases in hospital funding are over. Hospitals are like the anchors on our healthcare tug-of-war team. In the coming days, our hospitals will be called upon to take up a dynamic challenge, to improve performance within an environment of stable yet restrained growth. I recognize the challenges that this will pose to a hospital sector that has become accustomed to getting huge budget increases each and every year. But hospitals will not be asked to face this challenge alone. They will be assisted by our transformation agenda that at its core will reduce growing demand on the services that they provide. Hospital funding must be more stable and predictable, and spending needs to be aimed at achieving results. Let me tell you what I mean by that. For too many years now, government and hospitals have allowed a culture to develop in which many of our province's hospitals continually run annual deficits. And at the end of the fiscal year, the Ministry of Health faithfully bails them out. What's more, hospitals have been allowed to accumulate large working fund deficits, made up in part by unpaid operating bills from previous years. Servicing that debt is costing hospitals millions and millions of dollars, precious dollars, diverted from the kind of care that we all know patients require. There are lots of reasons why this happens, but I think we can all agree that it's not healthy and that the status quo is unsustainable. What's needed is a transformation to a new framework of accountability and sustainability. Not another short-term fix, but a true transformation. Let me tell you how this transformation will begin. I am announcing today that my ministry will provide Ontario hospitals with the $385 million needed to cover the operating shortfall for the fiscal year 03-04. With this funding, we will introduce a new approach of linking funding to achieving desired results. One of the starkest signs to me that we need to improve the way hospitals use their precious resources is found in nursing. Let me describe to you the state of nursing today in Ontario. Only 57% of nurses have full-time opportunities. Meanwhile, there were 2.7 million hours of overtime worked by nurses in Ontario hospitals. Hospitals purchased 2 million of those hours at triple time from agencies. Among healthcare workers, nurses are at the greatest risk of workplace illness or injury. For example, in 2002, nurses filed 1,481 WSIB claims totaling more than 50,000 days of missed work. Nurses are at the heart of our healthcare system, but this precious resource is being squandered. That's got to end. That's why I am announcing that $50 million of the $385 million will be targeted exclusively to create full-time nursing positions and improve the safety and working conditions for nurses. If hospitals fail to reach targets for creating full-time nursing positions, they will lose the funding, and it will be invested in other hospitals that can achieve desired results. We didn't authorize or approve hospital deficits, but we will pay them. The alternative would result in the shortfall being made up on the backs of patients and communities, and that simply is not an option. But this will be the last time this government will do so. From here on in, we're embarking on a new era of fiscal realism. If working people of Ontario can live within their means, it's time the healthcare system did the same. And that comment is not directed only at hospitals, but the entire sector, including my own ministry. It's time a new era of fiscal realism. It's time for that for all of us. I would also like to acknowledge that our government recognizes that hospitals are sitting on $721 million in cash pressures accumulated over the past few years. Quite frankly, I am amazed that this has been allowed to go on for as long as it has. How did we get into this mess? Frankly, there has been a lack of accountability from hospitals and a real lack of leadership from Queen's Park. I'm here to tell you today that those days are over. We are willing to talk